For many of us, much of our lives have gone remote for our safety. For others, that isn't an option. The pandemic has been an experience that has been and continues to be up close and in person.
It was like, it's okay. You see some horrible things. Of course, you're gonna feel horrible.
This week, how frontline workers are doing more than a year and a half into this pandemic and what they say still needs to be done.
A lot of it became exhaustion, pure exhaustion of the level of work.
This is The Race. Welcome to The Race. I'm Chris Stewart. COVID restrictions have been pulled back in many parts of America in recent months. It's allowed a return to normal that many of us haven't felt since this virus first entered our lives. But for those who are fighting along the front lines of this pandemic, they say beneath that feeling of normalcy is the reality of just how far we may be from putting COVID-19 behind us.
I usually tell people that the patients that come to the ICU, they're the worst COVID.
As a nurse in the intensive care unit, Kyle Gordon-Bidwell's job is a balance of delivering care and dealing with the realities of those who need it.
Unfortunately, most of our patients pass away. They don't make it out.
As contentious a topic as COVID has become, when someone enters the ICU, the truth is direct.
We'll do everything we can to save you, because it is what it is, right? You have COVID, and we'll do our best to save you.
Like many ICUs nationwide, the majority of COVID patients who enter Michelle Hurd's Central Michigan unit are unvaccinated. Here, the hospital says it's 9 out of 10.
It's hard to understand why some are not vaccinated, and so when I'm with my nurses, it's non-judgmental. The person is here for our care.
This is actually the worst part, when you see somebody who is 40 years old or 50 years old, and he just did not believe in the vaccine. And all of a sudden gets that sick in the ICU, and he said, the minute I leave the ICU, I will get vaccinated. And that's very sad, because sometimes they don't.
Dr. John Blamone says at Mid-Michigan Medical Center, the number of patients isn't as much a problem as the impact this pandemic has had on those who care for them. Like many hospitals, workers have left.
When I go home at night, I'm exhausted. Sometimes it takes a couple days to get recovered from my shift.
Largely, it's just powering through, being there for our patients, being there for my coworkers, and just trying to continue to do my best with that. I will say I don't know that I'm for sure through it.
The Delta variant has brought a strain on emotions and resources that many here thought would be over by now.
When we saw how effective vaccination was and things started to open back up, I was really taken aback that we have a significant minority of the population that just won't get vaccinated, and it's putting us all at risk.
But as patients continue to pack ERs and ICUs, many hospital systems, including this one, face an internal struggle. Around 37% of employees with Mid-Michigan Health, which runs multiple hospitals in central and northern Michigan, are not fully vaccinated. While Dr. Blamone regularly sees what this virus does to those who haven't received the vaccine, he says mandates aren't the answer.
I believe that people should not be forced to get vaccinated, should not make people's life difficult to get vaccinated.
Instead, he hopes the liberty to choose empowers personal responsibility.
We should be united in one message, which is we are all in this together, and we should be vaccinated for the good of everyone.
Decisions, he says, will save lives and bring relief to those still fighting on the front lines. Now, an unexpected group is stepping up to make sure kids get to school. It's the result of a school bus driver shortage that is impacting districts across the entire country. Alexa Liaco met with families who say they are desperate for the help.
Make no mistake, students are excited to be back in school. But getting students to school has been the toughest homework assignment yet for Superintendent Almia Beta.
We had a shortage with bus drivers to begin with, and COVID just compounded that. shortage.
Her district was desperate for a frontline worker she just couldn't get.
So it's not a full-time job, it's a part-time job. Many of our bus drivers were already at retirement age, and maybe with COVID, they just said, you know what, we're gonna retire now.
With no way to quickly hire dozens of drivers, a different group of frontline workers came to help. A group no stranger to this small community right outside of Boston.
At the beginning of this pandemic, National Guard came into Chelsea to do food distribution to our residents because we were the hardest hit city in Chelsea. They also came in during when the vaccinations first came out.
Now, the National Guard is taking students to school.
Come on, Jeremiah, get in there, buddy.
The governor of Massachusetts called in 250 National Guard members to drive students across the state.
Thank you. Go ahead, guys, get in.
But the crisis isn't just happening here.
This is spread across the country.
Nationwide, half of all students, about 25 million kids, need to take the bus to get to school. But 81% of school districts say they don't have enough drivers. In Texas, sports coaches have been asked to drive students to school in the mornings. And in Pennsylvania, some districts are paying families $300 per month to opt out of bus pickups.
And everybody's looking for drivers right now.
John McCarthy runs NRT Bus. For the first time in his career, he's hired recruiters to find drivers.
School bus drivers don't grow on trees, so we're doing our best to train and get some folks behind the wheel.
In the meantime, he trained the National Guard members to operate these small vans in a matter of days.
We were pretty impressed with the eagerness of the Guard. They do all kinds of things to help out folks like us, anywhere from protecting our freedom now to driving our children, so it's a pretty special detail.
And the Guard is helping some pretty incredible students too. Students like 11-year-old Evan, who needs some extra help getting to school.
He's autistic and he has problems walking, so his feet are fixed. So walking is an issue for him. Even though the school's not far, walking is hard for him.
Evan's parents both work. His mom, Jennifer, works overnights. So this driver shortage made school days really stressful.
I appreciate the bus drivers. I'm a frontline worker myself. So I know it's not easy being around, people, being exposed, but it's a job, it has to get done. These kids need to get to school.
Before the National Guard came in to help, parents said their students were getting dropped off here after the school day had already started. But now that there's a few extra hands behind the wheel, parents say their students are arriving early.
He's happier, he likes the small vans better. I'm just glad everything's somewhat normal for now.
While these frontline workers won't stay the entire school year, support for now is welcome help.
They are essential to our schools.
And they're giving students the chance to focus more on what's most important.
The folks that the National Guard are carrying will definitely have an impact on our future in America.
For The Race, I'm Alexa Liacco.
A pandemic surge in pet adoptions is pushing veterinarians to their limits.
People that work in this field are really passionate about what they do. There's a lot of empathy involved with every single family that comes in.
How they're coping with packed schedules and high stress. You're watching The Race.